Did you know there's a surprising, hidden connection between your mouth and your heart? It sounds a little strange, but it's true. The simple act of cleaning between your teeth could actually be one of the best things you do for your cardiovascular health. Stick with me because today we're diving deep into the science behind the oral systemic link. And I'm going to show you exactly how a tiny piece of string can have a massive impact on your body's most important muscle. So, what are we talking about when we say oral systemic link? It's a fancy term for a simple idea. Your oral health is directly connected to your overall health. Think of your mouth as the gateway to the rest of your body. What happens in there doesn't just stay in there. It can affect your heart, your brain, your lungs, and even your joints. And one of the biggest players in this connection is something we all deal with: gum disease. Let's break down what really happens when you don't floss. After you eat, tiny food particles get stuck between your teeth and along your gum line. These spots are hard to reach with a toothbrush alone. This leftover food becomes a buffet for bacteria. Millions of them live in your mouth, and they form a sticky, colorless film called plaque. If this plaque isn't removed, it hardens into tartar, which is much tougher to get rid of. Now, this is where it gets serious. This buildup of plaque and tartar irritates your gums, causing what's known as gingivitis. You might notice your gums are red, swollen, or even bleed a little when you brush. That bleeding is a key sign. It means your gums are inflamed and there are tiny open wounds. Gingivitis is the early, reversible stage of gum disease. But if it's left untreated, it can progress to a more severe form called periodontitis. With periodontitis, the inflammation gets worse. The gums pull away from the teeth, creating little pockets. These pockets get infected, and the body's immune system goes into overdrive trying to fight the bacteria. This chronic, long-term inflammation is the real villain of our story. The bacteria and the inflammatory byproducts don't just stay in your mouth. Remember those bleeding gums? They create a direct entry point for these harmful bacteria to get into your bloodstream. Once in your bloodstream, these oral bacteria can travel anywhere in your body, including to your heart. So, how does this lead to heart problems? Researchers believe it happens in a few ways. First, the bacteria themselves can attach to fatty plaques in your heart's arteries, a condition called atherosclerosis. This can contribute to the formation of clots. Imagine a clog in a pipe getting bigger and bigger. That's what's happening in your arteries. A blood clot can be incredibly dangerous. If it breaks loose, it can travel to your heart and cause a heart attack, or to your brain and cause a stroke. The second major factor is inflammation. The chronic inflammation from gum disease puts your entire body in a constant state of alert. This systemic inflammation is a known risk factor for cardiovascular disease. It can damage the lining of your blood vessels, making them more susceptible to atherosclerosis. So even if the bacteria don't directly cause a clot, the inflammatory response they trigger throughout your body can significantly increase your risk of heart attack and stroke. The evidence for this link is getting stronger all the time. Numerous studies have shown a clear correlation between people with periodontitis and a higher incidence of heart disease. Some research has even found the specific types of bacteria that cause gum disease inside the arterial plaques of patients with cardiovascular conditions. This isn't just a coincidence, it's a direct biological pathway. Think about it this way: you wouldn't ignore a constantly infected cut on your hand, right? You'd clean it and take care of it to prevent the infection from spreading. Your gums are no different. Bleeding, swollen gums are a sign of infection, and they need attention. So, what's the solution? It's surprisingly simple. It starts with flossing. Flossing is the single most effective way to remove plaque and food particles from between your teeth and under the gum line, the areas your toothbrush just can't reach. By doing this once a day, you disrupt the bacterial colonies before they can cause inflammation. You're stopping the problem at its source. Now, I know what some of you might be thinking. I hate flossing. It's awkward. It makes my gums bleed. It takes too much time. I get it. But let's address those points. If your gums bleed when you first start flossing, that's actually a sign that you need to floss. It means there's already inflammation. The bleeding isn't caused by the floss. It's caused by the bacteria. If you stick with it consistently and gently, the bleeding will stop in a week or two as your gums get healthier. And if traditional string floss isn't for you, that's okay. There are so many amazing alternatives on the market today. Water flossers, also known as oral irrigators, use a pressurized stream of water to blast away plaque and debris. They're incredibly effective and can be a lot easier to handle. There are also interdental brushes, which look like tiny pipe cleaners, perfect for getting into larger gaps. Or you can try floss picks, which are little plastic handles with a piece of floss already threaded. They're super convenient for on-the-go cleaning. The best tool is the one you will actually use every single day. Experiment and find what works for you. Your daily oral hygiene routine should be a 3-step process. First, brush your teeth for 2 minutes twice a day with a fluoride toothpaste. Make sure you're using a soft bristled brush and gentle circular motions. Don't scrub too hard. Second, clean between your teeth once a day using floss, a water flosser, or another interdental cleaner. This is the step that directly protects your heart. And third, visit your dentist regularly for professional cleanings and checkups. They can remove stubborn tartar that you can't get at home and catch any problems early on. Taking care of your oral health is not just about having a bright smile or fresh breath. It's an investment in your long-term overall health. It's a proactive step you can take every single day to protect your heart, reduce inflammation throughout your body, and potentially add years to your life. The connection is real, the science is clear, and the solution is in your hands. So tonight, when you're getting ready for bed, I want you to remember this conversation. Pick up that floss or turn on that water flosser. It's not a chore. It's an act of self-care. It's a powerful, simple habit that protects you from the inside out. Your heart will thank you for it. Thanks so much for watching today. If you found this information helpful, please give this video a thumbs up and consider subscribing for more content on how to live a healthier life. And share this with someone you care about. You could be helping them protect their heart, too. See you in the next video.